Good morning, everyone. My name is Angela Preocanin, and I am a dedicated registered nurse and union activist. I am the first vice president from the Ontario Nurses Association. I'm honored to be here today to acknowledge the day of mourning. It's a national tragedy that virtually every day workers die and become injured or are made ill at work. All of these incidents are preventable. Collectively, we must come together and call for action to eliminate hazardous working conditions that impact our physical selves and our mental health. When we think about workplace injuries, we often consider the physical wounds, broken bones, cuts and burns. Or we think about infections, SARS and COVID. Thousands of healthcare workers have become ill and died. But what COVID has also brought to our dedicated healthcare workforce is stress, higher job demands, burnout, low job control, and significant moral injury, all factors that contribute to mental health concerns. COVID's unprecedented circumstances have increased the risk of PTSD, substance abuse, and even suicide amongst our nurses and healthcare professionals. Let's look at the facts. 7 in 10 healthcare workers report worsening mental health conditions during the pandemic, according to Stats Canada survey. In a Mental Health Canada survey conducted last year, 93% of nurses reported stress, 86% reported experiencing anxiety, 76% reported exhaustion, burnout, and 75% said they were just clearly overwhelmed. These are very troubling stats. The impact that the pandemic has had on healthcare workers' mental health is deeply concerning, and action must be taken immediately to curb these disturbing trends. We do have solutions that could help our colleagues through these very challenging times. The government, employers, unions, and associations must work together to instill early intervention and supports that can include increasing the level of mental health supports for nurses and healthcare workers, improving access to mental health training and enhancing coping strategies, and implementing evidence-based return-to-work programs for workers. But the most important thing we can do is to fix the conditions that are contributing to this situation in the first place. I'm talking about chronic understaffing that is putting incredible pressure on workers to care for more and more patients with shrinking supports. We must act now to put in place policies that improve healthcare staffing and ensure the right skill mix. There's so much more that can be done to support improved mental health in nurses and healthcare professionals. The threats to mental health are so far-reaching and affect literally thousands who've been traumatized during this horrific pandemic. On this day of mourning, I call on governments, employers, unions, and associations to adequately address mental health conditions in workers once and for all. We cannot be silent anymore. Thank you.